what is Lucas County's current standing with COVID-19?
Our current standing is much like the rest of the larger counties in Ohio and many of the other smaller ones. We're seeing an increase in COVID cases over the last couple of weeks. We're not as good as we were relative to taking care of the issues at hand, such as not going to mass gatherings. We need to wear our face masks. So our conditions in Lucas County, again, are not as good as they were a couple of weeks ago, and actually we're getting into a pattern right now where we're seeing elevated cases almost every day.
What are you doing to encourage residents to stop the spread of the virus? What are some of the precautions that they should be taking in order to get our COVID-19 threat level back down to a lower, safer level?
Again, the reason why we were at lower levels several weeks ago or over a month ago now was because, again, we weren't going out to those mass gatherings because we were sheltering in place, if you would. We were taking our cues from the governor and from ODH to, again, limit contact with individuals, and then again to do hygiene, as we've talked about many times. Now we've kind of opened up the door a little bit to allow this virus to get back into each one of our communities by, again, going out to bars and restaurants and not adhering to social distancing when we're there. We're going out to gatherings, maybe birthday parties and things of that nature, where we didn't do those a couple weeks ago. And again, what we're trying to do is a couple things. One is tell people, if you don't need to go out, please don't. If you go someplace where there's a lot of people, turn around, go someplace else. And again, the big thing right now is wearing a face covering.
Do you think we're doing enough testing on the county level? Because testing doesn't give you coronavirus cases, but it does make you aware of the amount of cases that we have. So do you think we're doing enough testing to ensure that we know our current standings with COVID-19?
Again, if you look at the current testing rates that we're doing, there is a backlog of individuals that want to get tested. So a short answer to your question is we don't have enough of a capability in the county right now for the amount of people that want to test. Now that was last week. I don't know what today's going to look like, but again, we were just hearing that people were on a schedule for days out to be tested. So again, that is a concern. But again, we're always looking to bring in additional testing for the community. Again, that is one thing that we do want to do, is try to bring as much testing as this community wants.
Switching gears to the reopening of schools,
Mm-hmm.
do you think that schools should reopen at full capacity? And if they do, what could be the consequences of a full school reopening on teachers and parents?
Sure, that's a great question. I want to let you know that the school systems in Lucas County and the health department have been meeting for a couple months now, trying to get plans together, have very frank discussions of what we need to do. Again, what we've talked about in those meetings too is that it's going to be scenario driven. What we need to do at that point in time. Again, the current conditions with cases inside of our county as well as other counties it is such that we probably want to take a good hard look at if we're going to be able to go back 5 days a week to school. So again, those discussions are still ongoing, and we got a little bit of time here to make that final decision. But again, bringing people together in an environment where there's a lot of virus, if you would, much like inside of a school, again, you've increased the risk of spreading that virus further. So again, it all depends on how much virus we have in the community at that point in time, and then the plans that the schools want to enact.
How much do health officials know about students spreading the coronavirus?
Again, another great question. There's research out there, and it kind of goes on both sides. Unfortunately, that's kind of what we're dealing with right now with COVID, since it is a relatively new disease. I just saw a piece of research here that they're saying that even 10-year-olds have the ability to actually spread the virus like an adult does. So again, that's concerning. The idea again is that you want to make sure that we limit the ability for this thing to jump from person to person. So again, it goes back to the amount of virus in the community. It goes back to how good we are at social distancing and wearing our masks. The one thing that I will say right now, if we really want to have schools at some point in time in the near future go back to a type of normalcy, or a type of normal operations, if you would, as well as the sports and everything we want, we really should decrease the amount of virus in the community. Again, you do that by the things we've talked about, but also then too, wearing a face covering.
What should schools do to reopen safely for students, staff, parents, and everyone else in the community?
Again, you got to start with a plan, and our schools have plans. Some have been finalized, other ones are almost there. So you got to be able to, again, have at least a starting point. As we know, any plan as we go through a situation, it's going to have to adjust. So that plan is going to have to adjust. The biggest thing that we need to do is, again, social distancing, again, making sure that we're wearing our face coverings, we're doing proper hand hygiene, and again, those things we've always talked about here over the last couple of months with COVID. But more importantly, understanding that the disease is out there, and there is always that possibility of a school having a COVID issue if they don't take as many precautions as they possibly can.
Ohio Governor Mike DeWine recently mandated face coverings when you're out in public. What are your thoughts on that mandate?
Mandates, I always have a hard time with a mandate such as the face coverings, because I really would like all the public to pick up something like that on their own. Unfortunately, there just wasn't that feel good type of atmosphere in the community to have everybody start wearing a face covering. So I think the governor had to do that. And again, I don't like wearing a face covering. I know a lot of us don't, but again, it really truly is a great way to stop those droplets that have the virus, potentially could have that virus, from getting to somebody else. So again, it's something we need to do if we want to see a decrease in COVID numbers.
How much do we know about herd immunity? Because a lot of people are saying that we should be okay going out in public to expose ourselves to the virus. But is there really the possibility that herd immunity even exists with the coronavirus?
Most of the studies that I'm seeing right now, we're nowhere near that herd immunity. Some people are saying you need 60%. Others are probably saying more like 80% of the population to reach some sort of herd immunity. So we're a long ways off from that. That's why that vaccine is probably so important at this point in time, to try to get that out to the public once it does become available. So the issue with going out and I guess wanting to contract COVID-19, the problem is this isn't like a common cold. There's some real issues to some people who would come down with COVID-19. And something as simple as just not feeling good for so many days, but then chronic conditions over a long term trying to heal, going on a ventilator, and then the last, but one of the worst thing is having a loved one pass away. We've heard stories where older individuals, this does attack, and it does cause severe issues to many of them. And that is a definite concern, but we're also hearing now that even younger individuals are succumbing to this. So again, it's just not a good idea to wantingly expose yourself to COVID-19 just because you want to become infected and think that's the best way to combat the virus.
Lucas County Health Commissioner Eric Zgodzinski, thanks for joining me.
Thank you so much.